Good afternoon. Thank you so much for coming today. My name is Martine Hackett, and I am the chair of the Department of Population Health, and I'm also one of the coordinators of this symposium. And on behalf of my fellow coordinators, it's our great pleasure to welcome you to the second annual Hofstra University Presidential Symposium, Solutions for a Sustainable Tomorrow. We've assembled 3 days of speakers, discussions, and events to explore how Hofstra University can be part of the solution for a sustainable tomorrow. Sustainable solutions can be found at the intersection of science, economics, and social equality, with education also playing an important role. And there's little doubt that climate change is our largest and most daunting sustainability challenge. We've structured our symposium around these 3 key themes. Tuesday was Leading by Example, Hofstra's role in building a sustainable tomorrow. Yesterday was devoted to addressing and adapting to climate change. Finally, today we will conclude with Local Initiatives, Hofstra's role in supporting sustainable communities. Panels will consider how Hofstra faculty programs and are collaborating with local communities to promote sustainable outcomes. And I encourage you to consult the symposium program online. There's also some paper copies of the schedule in the back. And all of these sessions have been recorded, so we encourage you to take a look at the recordings of the past sessions as well. I also want to just give acknowledgement to our, since this is a presidential symposium, to our president, Susan Poser, who is in the audience, hello, and our provost, Charlie Reardon, hello. And so without any further ado, let me, it's my pleasure to introduce Dr. Renee McLeod-Sordjan, who will introduce the panel, Community Equity for Sustainable Tomorrow.
Thank you so much, Dr. Martine Hackett, for that. And thank you, Dr. Poser and Dr. Reardon, for being present. It is my pleasure to, on behalf of the Hofstra School of Nursing and PA Studies, to introduce 2 of my faculty who will bring us through looking at solutions for sustainable tomorrow as it relates to educating the healthcare workforce, educating nurse practitioners particularly, and looking at some of the local, and global health initiatives for a sustainable tomorrow. I'm going to introduce first Dr. Michael Cassara, our Associate Dean for Interprofessional Education and Research. Dr. Cassara has published on many behalfs for medicine and nursing, as well as being a fellow in the National Academies of Medical Educators. As well as introducing Dr. Deborah Ricardi. Dr. Deborah Ricardi is our inaugural project director for our HRSA grant for Ideals. I'll let her discuss that more as she introduces her own background in moving as a pediatric nurse practitioner to helping with sustainable tomorrow in pediatric populations. Dr. Ricardi?
Thank you so much, and I am honored to be here as well as my whole team. So I will just give a brief introduction. I hate to say this, but 35 years a nurse, but for the last 22 years, my role was outreach in the community. So I am very familiar with working with grants, working with communities, and the diversity that exists in the communities. So I was delighted I am a year here now, full-time at Hofstra. I come from Cohen Children's Medical Center over at Northwell, and I am delighted here, as I mentioned, a year working with the students of course teaching, but also program director for the HRSA grant that Dr. McLeod mentioned, and it is our Nursing Workforce Diversity Grant. So I will take you through the journey of this grant. So without further ado, what we are presenting here today for the Community Equitable for Sustaining Tomorrow, for Sustainable Tomorrow, is addressing the social determinants of education to promote health equity. So as you see here on the screen, the transition that you see is from previous work in the nursing and health professions literature that describes the transition at different levels of education. And as you see, it's important to create a nursing pipeline so that we can share information with students, at a very early age. And what we want to do is not only capture them, as you see, at the high school level, because if we talk about a pipeline, many times we're in the high schools talking about pipelines and letting students know the careers that are there. But it's so important for us to capture them at an early age. So elementary, middle school, so that they can begin setting goals for themselves about a career that they want to advance to. They also have to be familiar with that career. So I'll give you an example. I am teaching research, and yesterday I had a class with 32 students with our CRNA program, and Dr. Mike Cassara will talk a little bit about the CRNA program. But 32 students, so they are already have their bachelor's, and I asked them, let me ask you a question. We started talking about the inequities that exist in healthcare, and I said, how many of you, when you were in middle school and elementary school, knew that there were degrees further than a registered nurse? You're now an advanced practice degree. How many of you knew that that was there? Not one of them raised their hand. And then in doing this pipeline, and I'll discuss that a little further, I've created an educational program about essay writing for nursing, because not only do the high school students enroll in Hofstra University, but they have to write two additional essays to enter the nursing program at Hofstra, because it's a direct entry. So as we're doing these programs, of course, they're on Zoom. A number of the students shared with me, how come we didn't have this information in elementary school or middle school? Because I could have prepared myself better for this journey. So hence the reason that this nursing pipeline is so important, and really not just for nursing, probably any profession. But again, I'll address just our nursing pipeline in the school. So as you see in front of me, of course I have to define. So the CDC defines the health disparities. We already know about health disparities. COVID-19 brought them to the forefront. But health disparities are inequitable and are directly related to the historical and current unequal distributions of social, political, economic, and environmental resources. And we know that we can improve health risks and reduce disparities and the inequities by addressing the social determinants of health. But being in education, we need to take that one step further. We need to address the social determinants of education. And we have to make sure that we add this into academia. So we have to we have to level the playing fields. So really what I mean by that is let's take someone entering or getting accepted into our School of Nursing. We have our new undergraduates. So we have our second inaugural class. And let's take different high schools, and you line up 4 students that have a GPA of 4.0. We cannot assume that they had equal education and equal access to AP classes and advanced classes. Every school is different. So now they come to us. We have to make sure that we align with the social determinants of education when they enter Hofstra University, when they enter the School of Nursing program. So we know the social determinants of health often drive health disparities, which leads to, for us for nursing, poor patient outcomes for disadvantaged individuals. So the goal in healthcare is, if we increase the numbers of health professionals from disadvantaged backgrounds to go into these communities, we're now getting at the roots of the social determinants of health. We now can address that. Communities of color with increased economic disadvantages and impaired social determinants of education had the highest morbidity and mortality during COVID-19 pandemic. So again, by diversifying the healthcare workforce, we can address these issues. This is why the pipeline program, as I mentioned, is critical at all stages. Yes, we want to address the middle school, we want to address the high school, but those that have graduated with their RN, we have to make sure we reach out to them and let them know advanced degrees are there. They're in the education, and they will make a difference with the inequities that exist in healthcare. And what you have in front of the screen is one of course I have to put a book if somebody's interested in furthering their education on the disparities that exist. Linda Villarosa is a contributing writer for the New York Times, but she's also an educator, she's also a writer, she's also a publisher. And she did a piece for the New York Times, and she uncovered the race inequities and health. And as she began uncovering this and doing a deeper dive, she uncovered that maternal mortality rates, it's very small on my screen, so bear with me, in the United States, she discovered that Black women with college degrees were more likely to experience serious complications while giving birth than white women with only an 8th grade education during pregnancy and birth. So let me stop there for a minute. Digest that. So her research uncovered the issues of racism as a driver for health inequity for Black women and of course other cultures. So that's her book. It's Under the Skin, The Hidden Toll of Racism on American Lives and on the Health of Our Nation. And that was just published in 2020. So now let's get to the pipeline. Dr. McLeod-Sordjan mentioned the pipeline that was created under our HRSA grant. So our HRSA grant was given to us, it's a year old, it's $2.1 million, it's a 4-year grant, and it's to diversify the nursing workforce. So we coined it, of course it's the Hofstra School of Nursing, but we put a name to it. So let me just put that out there. So if anybody hears about the Ideals Grant, it is from the School of Nursing, and it is Inclusion, Diversity, Equity, Access, Leadership, and Success. So this grant it's multifaceted, but some of the programs I'll focus on is the pipeline that we've done, the mentorship and student success that we've trying to work with, and the poverty simulation. We know that diversity creates an environment that fosters appreciation of values, skills, and the abilities of everyone. We know that we do our best when we embrace the diversity of ideas and experiences that characterize social, cultural, and the intellectual world. Diversity includes the recognition and incorporation of everyone's voices and perspectives in thought and action, in policy and practice, in all spheres of the academic world that we are in, that I am in. It involves recognizing the value of difference and the inclusion of all members of groups that experience discrimination or underrepresentation. So we are working, as I mentioned, with the pipeline, our undergraduates, middle school, high school, the community, internal resources. So I'm just gonna go over a few of those bullets that are up there, the pipeline. So this is our pipeline program, couple of pictures, we all need pictures. And our let me just give a little background. Pipeline programs are proven solutions to addressing the inequity issues and help promote a culturally competent, diverse, and prepared healthcare workforce that will enhance patient care and ensure health equity. So by us preparing students at a young age from underrepresented and economically disadvantaged backgrounds for healthcare professions, we can get them early entry into thinking about making the connection about the goals that they want and setting themselves up for that goal. It's critical that we reach out to healthcare centers. And of course, we're connected with Northwell, local elementary schools, middle schools. These, as I mentioned, are just as important at high schools, because here's the high schoolers sharing with me they should have learned this information earlier on. So that's where we come in. So our Ideals program, pipeline, we're out there, and some of the pictures that you see up here, all the way to the left, I don't know if you can see my mouse, but all the way to the left, we have our faculty in high schools sharing information about what we offer, talking about nursing. And Dr. Mike Greco is down in the left corner. He talks about men in nursing. Then we have our pipeline where we've done, and that's our career fairs. We've done school fairs. We've connected students with real leaders. So if you look on the screen, as well as working internally. So if you look on the screen, and if it goes correctly, that is a picture of Gina Granger. Gina Granger is from the Hofstra School of Medicine. So it's important that as a school of nursing, we collaborate. So important. So she runs the Medical Scholar Pipeline Program. She's been doing that, I want to say, between 10 and 15 years, and it's all for medical school. This year, we introduced during the summer the nursing component. So you'll see Danielle Parker standing there with myself and Gina Granger, and Danielle Parker is a graduate of Gina Granger's Medical Scholar Pipeline Program. She decided to do a career in nursing. So we brought her back to the high school students as she shared her journey, how she became a nurse instead of the path that she originally thought she was going to go on. If you look on what just was highlighted, that's Dr. Sandra Lindsay. And if anyone's not familiar with Dr. Sandra Lindsay, she is the first person in the United States to receive the COVID vaccine. She is a nurse from Northwell, so thank goodness we had the connections. And we asked her to come speak to our high school students. She also spoke to our undergraduate students. She's more than willing to come and speak to students because she shares her journey. She shares her journey understanding the culture, understanding her own culture, about the hesitancy of vaccinations. She knew how important this vaccine was, and she shares with the students. So she's a change agent and is in asking students to also think about being change agents, about how she knew her own community was hesitant about vaccinations and how important it was for her to get vaccinated. She also shares, so I'll give a shout out, she had no idea she was going to be the first person to receive that vaccination. And she said all of a sudden she received the vaccination and the press is all over her. And she still goes out there. So more power to her, but I'm so grateful to her for sharing the journey. And it empowers our students. And if you continue to look, we have our STEP program. So we're out. Oh, let me step back. What's so important is in the right-hand corner of that screen is our undergraduate students. Those are our second undergraduate students. So we are empowering them to be change agents and leaders, and they are joining us in the community, but they're also joining us with our programs here at Hofstra that we also offer to the high school students and sharing their journey of how they decided to do a career in nursing. And not everybody's journey is the same, so it's so important for students to recognize anybody's journey can change. Everybody has obstacles that they meet, that they encounter, and it's really okay, right? No failure, we learn from our failure. So our mentorship program, I quickly mentioned our mentorship program, but students come from different academic backgrounds. We know that. I mentioned they come here, they don't all have the same playing field. So we had our first undergraduate class join us, finish the class, shared with us the struggles they had in biology and chemistry. So they said to us, you have your second undergraduate class coming in, you have to do something with them for bio and chem. So thank you to the undergraduate class. We brought in the ALEC program, which is a 6-week, we did it for 6 weeks during the summer. It's a prep program for chemistry. It's from McGraw-Hill. And we brought the students in for the summer. We did a couple of Zoom sessions. I know they weren't happy, but we shared with them how impactful this should be and how prepared they'll be when they begin their journey in undergraduate. So we gave them the ALEX program. If you see down to the left, we also gave them resources, textbooks, and not to scare them, we said to them, please open it up, don't let it sit and collect dust, but it's really to give you some type of a resource prior to starting school. So let's see how the success of our second undergraduate class takes off. But we also created a mentorship program. So in addition to giving them resources, so we created a mentorship program. We brought our first undergraduate class in. We know that mentorship is a reciprocal learning relationship, but it's a relationship for both the mentee and the mentor. And Dr. Alice Finori helped us on the journey. She's from the medical school. She's also from Northwell. Mentorship is powerful. So we had our undergraduate students, we connected them with mentors. I had to be very creative because we had 32 students and I had to find mentors for them. Reached out to Northwell, used internally, but the beauty of that was they shared how beneficial the mentorship was with their mentor, that our new class coming in, our second year, our first year, but our second class coming in, they all agreed to mentor them. So I'm so excited, and they even created the list. So we are so excited that we now have our second group. Every one of them will be mentored. So the other piece that I wanted to mention as I'm quickly looking at my notes is up on the screen, you'll see how important it is for us to, and I already did mention it, to have the undergraduates, to have even the graduates go out and be proactive in the inequities that exist in healthcare and share the information with the community. So it is giving them the social responsibility to address the determinants of health so they in turn can be change agents. And this was important. So this was something we did during the summertime, and I'm excited. This is going to take off. This was our pilot program. So this was the poverty simulation that you saw on that timeline. And this is, let me just talk about the pandemic's effect. We all know what the pandemic did for us. We all felt it. But the effect on poverty in the US increased due to the economy and the soaring unemployment. It's not hidden. It's been all over the news. The U.S. Census Bureau announced September 14th, 2021, that the median household income in 2020 decreased and increased poverty was officially increased, and it was stagnant for 5 years. So I'm not a political science major, couldn't tell you where it's gonna go, but we are in the midst of poverty. So how important for us to let healthcare providers understand poverty and understand that the community they serve may be dealing with poverty. So according to the 2021 Current Population Survey Annual Social and Economic Supplement, the poverty rate increased for non-Hispanic whites and Hispanics. Among the non-Hispanic whites, 8.2% were in poverty in 2020. The Hispanics amounted for 17%. And the Blacks had the highest poverty rate of 19.5%. So this real-life poverty simulation that we offered to the students allowed the participants to step into the life of someone living at poverty or just below. And the experience, right, why did we do this? It inspires healthcare providers to recognize and find solutions for all patients so we can break down that barrier. So some of the photos that you see there, the poverty, so the students, the undergraduate students, even the graduate students, as well as faculty. So we even had pharmacy students from Hofstra come and join us. We just needed lots of people, so we sent a lot of emails out. But how the poverty sim was we set up on the perimeter were all government agencies that anyone would have to visit. And then internally, we had families. We had about 16 families set up. Students were assigned to families. It could be families that were single families, a male family, a family run by a grandparent. They had no idea who their families were, and they had no idea what the scenarios were. They had 15-minute scenarios, and each 15 minutes was a week. So they had 4 15-minute scenarios. They lived the life of someone in poverty for a month. I cannot begin to tell you, I don't even think the pictures do it justice, of the frustration these people felt, the families, let's quote unquote families felt going through these scenarios. And again, let them understand when we see a person, when we see someone and we're a healthcare provider, we don't really know what's behind that person. I want to share with you a couple of quotes, because of course we did a post survey. So here's just a few comments of the post surveys from the students, undergraduate or undergraduate, because we did have graduate students. I learned how hard life can be and how misunderstood many people suffering from poverty can be. Many things go on in people's lives that I don't necessarily think about. Nurses need to treat people the same, no matter what the background. This experience will assist me in preparing for my nursing degree to be more empathetic to every patient. I don't know what factors in their own lives may influence their stress level. Understanding people's perspectives when they tell me they can't afford something, and then treat people the same. They were quite inspiring, and the messages that we shared was, just imagine a patient coming here, that you're taking care of a patient, and you ask them to come for a follow-up visit. Can they actually get there? They experienced that in the poverty sim, where they told them they had to come back. They couldn't get there. They had to find bus money, they had to find transportation, they had to find childcare. And the other thing, you write a prescription. How do we know that they can afford that prescription? So those are the barriers that we're trying to erase so it's equitable for everyone. And the last thing that I'm gonna leave you with, and again, a huge announcement for us. We've worked with partners internally and externally, but for us, Hofstra has the STEP program where they work with high school students through the school year, October through, I believe it's October through May. This year, I'm happy to say we're putting in, of course, a nursing line. So we have a track, it'll be a nursing track from October to May. And I have creative educational programs for the students entering entering that track that will immerse them in nursing. And then, of course, I want to leave you with partnerships. How important are community partnerships? We've made our partnerships internally with Hofstra, and we're still doing that. But we've had partnerships from, of course, MAP-IT program, School of Medicine, and I have to mention, I have to put a shout out for the School of Law. So the School of Law, we found out, thank you, Dr. Judge Fern Fisher, when we were putting together this poverty simulation, there is a kit from, I believe it's Missouri Hospital, put the kit together, so I can't say that we made our own kit. So we reached out to purchase the kit, and of course, because of COVID, it's on back order. It's probably sitting somewhere, in the shore somewhere. We found out that the School of Law had it. Reached out to the School of Law. Judge Fern Fisher was so gracious to say, we'll let you borrow it, but not only will we let you borrow it, I'll educate the staff on how to expedite that, and I will be there the day of the event. So we don't do this in a bubble. We do this with partnerships. And additionally, our external partnerships. So I mentioned MAP-IT program at the School of Medicine, School of Law, Northwell Health, Hofstra D&I office, Diversity and Inclusion, external partners that we are continuing to build. Long Island Latino Teachers Association, hundreds of people are in that. We're hoping to host LILTA program here. It's about 250 students. We've made inroads with the Uniondale School District, the Baldwin School District, Roosevelt School District, and as you see in front of you, chapters. It is important that we create a sense of belonging. So our sense of belonging within the School of Nursing is breaking down the barriers, and let's bring chapters in. So we have the Men in Nursing chapter, we have the National Hispanic Association of Nurses, the Black Nurses Association, and the Student Nurses Association. I'm so excited to have the Student Nurses Association, because when we go out into community, I hit them up for everything. But again, it's a learning process for them. So I want to say thank you, and I hope I didn't overspeak here, but I am going to pass this over to Dr. Michael Cassara.
Again, likewise, I would like to thank Dr. Ricardi. I have big shoes to fill, and I also do want to thank President Poser, Provost Riordan, Dr. McLeod for the opportunity to speak to the Hofstra Northwell academic practice community. When we came back to this title slide with intent, because when you look at the title of the symposium that we're currently engaged in, and we think about what community is, I mean, community at its core is diversity, equity, inclusion, and belonging in a nutshell. And sustainable tomorrow, when I think of that phrase, I just think of equity. and equitable opportunity and ensuring that for the future. And when I think about the subtitle to this, the symposium today, I think about if we want to have community health equity, we need to really address social determinants of health. And so if we want to address that, we need to, in the educational pipeline and then in the healthcare system that emerges and the stakeholders within that pipeline that actually help to impact social determinants of health, we need to then ultimately address the social determinants of education. So that's a phrase that I haven't seen in the literature, the social determinants of education, but obviously it's there. We all feel it and we all know it when we see it. So we wanted to pay a little bit of recognition to that. We also want to take the story a little bit further. We want to just look forward a little bit, based on our experience at the School of Nursing and School of Nursing and PA Studies. Just to situate myself in context, I'm actually not a nurse. I'm a physician by training, an osteopathic physician with a background clinically in emergency medicine, who fancied the idea of becoming an educator. So spent a good portion of my career learning how to become a frontline educator and then a backline curricular architect. And then really took an interprofessional approach to that as it related to health professions, education. And now at a place like Hofstra that intersects with Northwell Health to form an academic practice partnership, and then just the Hofstra community with all the other non-healthcare professions, or what would be perceived as non-healthcare professions typically. It's just amazing that it really does take a village to sort of create a community that ensures health equity for a sustainable tomorrow. So what I would like to say, there are a couple of facts, but I'm going to keep the literature review short. Just to say that community healthcare outcomes, and the literature shows this clearly, they improve when the stakeholders within the communities and the healthcare systems that serve and live within those communities, when they're all aligned. And so we've really taken a close look at this, and I want to go back to this graphic that Dr. Ricardi showed before, because we really look at this graphic. It took a lot of time to sort of put this together and to think about what is the trajectory in nursing. Now, as a physician, why do I want to focus on nursing? When I really think about it, coming from elementary and middle school and then going into high school, in that pre-secondary education and that pre-higher education trajectory, it's really the nursing degree that's the most accessible. And it's probably the most accessible health profession. If you think about all the professions that exist, it's probably one of the most accessible ones that you can enter into and emerge out of very quickly. And if you think that if you're someone who identifies as being an underrepresented minority, or if you feel that you're economically disadvantaged, or just think of the person who's the first one in the family to ever go to college, this is a way to enter the health professions. And so you can enter it a lot of different ways, and that's what this graphic sort of shows to the left of this graphic. But as you move forward, and we want to take a look forward. So now you've graduated with your baccalaureate nursing degree from a place like Hofstra or elsewhere in the country. And let's say you actually do, now the preferred degree is the Bachelor of Science degree with a major in nursing. That's the preferred degree. We realize that there are challenges with returning back to graduate school. And why is the return to graduate nursing education, why in particular is that so important? Well, first of all, if you compare it to the other health professions, it still is a very appealing and a very diverse way to engage in the healthcare system. There's so many things you can do from the graduate nursing degree compared to the other professions. And I think if we're honest with ourselves from the other professions, we sort of have to realize that. What's also just unique, every profession has a role and an opportunity. So one's not necessarily better than the other, they're just different. And it's sort of an embodiment of diversity that all the health professions can engage in community healthcare equity. But I must say, having learned a little bit about the nurse practitioner and the other roles that advanced practice nurses have, I have to feel that they just have something special about having been a nurse first that gives them something different than the other professions that makes them just very suitable professions for addressing these inequities that we have and promoting sustainable communities at large. The problem is that people terminate at the baccalaureate degree and they don't move onward. And that's the truth. And so we have to examine the reasons, and this trajectory doesn't really show all of the reasons, but it does imply some of them. So we have to acknowledge that the graduate nursing student is a unique population. They are older, they are generally more mature, just by virtue of the chronology that it takes to sort of navigate the pipeline from the earlier parts. They often have families, relationships, children, and responsibilities to their immediate community and then their larger personal and widespread community of family and friends and other professionals that you might not have when you're a little bit earlier in the trajectory. I know that when I was in undergraduate training, and then I moved on to even medical school, it just was not the same as what I see now when I teach graduate nurses at different levels, whether at the master's or the doctorate level. It's just not the same. I mean, I had no relationships. I barely had to take care of myself and just show up on time, and everything took care of itself. And having a daughter now that's of college age, she's asking me, what do I do? And I said, well, if you ever wanted to consider the health professions, consider nursing. First of all, it's very diverse. I said, plus you can get in and out, but I would say, but think of it for the long haul. Graduate nurses in general have lots of barriers. So all of them share that. And then if you think about the underrepresented minority or the economically disadvantaged or the first person in the family who's gone to, let's say, 4-year university education and now is returning back for graduate school, that person has even greater barriers. And I just want to point out that Hofstra, the Hofstra Northwell School of Nursing and PA Studies has done an excellent job. I mean, I'm a little bit biased, so I must admit that. But we've done an excellent job at trying to ensure better diversity, equity, inclusion, belonging among the student body. So I'm going to show you some graphics of what it looks like, our student body right now in the graduate programs. And I'll just show you the most recent graphics. First of all, one of the diversity issues in graduate nursing, well, in nursing in general, but especially in graduate nursing, is the male to female ratio. I would have never thought about this, but it's true. It's interesting that maybe a personal sort of story or anecdote that I could share is that I'm in healthcare in part because I had an older brother who was 10 years my senior, who started out his journey into the health professions as a paramedic, but then went forward as an associate's degree nurse. A male nurse back in 1979 or 80. I mean, that was a very unusual thing. And as an associate's degree nurse, no less. And then kept going back in the trajectory, which was remarkable for that time, to be a male nurse, to go back into that trajectory, go on to get the bachelor's degree, then to get the master's degree. Along the way, the bachelor's degree became a bachelor's degree in physician assistant studies, no less. So my brother is an example of someone who's crossed over fields and actually was an intra-professional person at a time when that really wasn't necessarily a thing to be acknowledged, but crossed both ways, so to speak. I think I saw that, got scared, went to medical school. But nursing has this diversity problem. The diversity problem, obviously, in more traditional sort of metrics, does look like this. And I have to say that when you look at a graphic like this is actually somewhat better than the national average, for sure. But there's just an underrepresentation of the underrepresented minority and the economically disadvantaged in the graduate nursing education programs. And while it's better here at Hofstra than at most places across the country, I must say that it's still a problem, something that we know. What I will say, though, is that, and what makes Hofstra somewhat unique among other programs and schools across the country is that, well, one is that we have a type of program that's like the first of its kind. We have combined and created a new profession. So we're sort of thinking outside the box with some of the needs of the community. So the creation of the CRNA AGACNP program, now that's a lot of letters, but it's a certified nurse anesthetist combined with an acute care adult gerontology nurse practitioner. The profession never existed before Hofstra created it. And so that's sort of like forward thinking on the part of the academic practice partnership that exists between Hofstra University and Northwell Health. So that's one type of program we have. We have a diversity of the other types of programs. We happen to have focus in acute care, adult gerontology nurse practitioners, and then we have family nurse practitioners and psych mental health nurse practitioners. So having the 4 of those programs, what I would say is that the master's or the DNP nurse practitioner in essence, the advanced practice nurse is a profession, a set of professions that's well suited to addressing community healthcare equity, because the graduate nurse programs and the advanced practice nurse in particular, across these multiple roles that we have here at Hofstra, they don't only represent the practitioners, they represent the leaders and the researchers and the people who design the initiatives that help to ensure that there's community healthcare equity. We've got that here. And so then the challenge becomes is that how do we have our communities and our healthcare providers look more alike, act more alike, think more alike, share common values? They can disagree on other things, but they have to have as a basis some of the things that really are the same. And it is proven, like we said before, is that practitioners that look like the communities they serve produce better outcomes. That's fact. So we have to address that. What also is fact is that underrepresented minorities and economically disadvantaged students, they are going to avoid the transition to return. And there's lots of obvious reasons. It's just costs too much. There's too many competing interests. They are similar to the barriers that others have when they return to graduate school, but they are just exploited and they are just hit harder in this group. And so we have to address that. Some of the work that we're doing, forward thinking then, is how do we fix this? So we have gotten some funding. Now, separate from the Ideals Grant, we've gotten funding from Hofstra University to think about this problem. And we really wanted to propose the implementation of a gap analysis. So we know that if we have underrepresented minority and economically disadvantaged students, and if, first of all, we have students that have made the commitment and they have jumped back into the graduate nursing school arena, so they come back. When they come back, we suspect that they are more likely to probably need supports, but we're not exactly sure what the supports are. And so we really want to characterize what those are because we want to know how to address them. And how to support students so they have academic success. Looking backwards then, we could probably translate that on the undergraduate side is to address them there, or to address them even in the pipeline before they even make it to graduate school. Imagine that, I'm sure that if we ask the question that Dr. Ricardi spoke about, but we ask it of nurses in the undergraduate program, do you know what the opportunities are as a graduate nurse? I bet early in their trajectories, they might not know. So what does it look like to be a student, let's say here at Hofstra, who's coming back? And what's the experience like? So I couldn't tell you exactly what the experience is like specific to the underrepresented minority or the economically disadvantaged or the first-time student who's now for the first time, let's say in the family, coming back to graduate school. I can't tell you that, but I could tell you what it looks like for all students because we have de-identified aggregated data of that. And so just to sort of situate, where is the student at a place like Hofstra Northwell in our School of Graduate Nursing and PA Studies? Well, the student's at the asterisks. In the first year, we've taken a look at what the transition is like when you come in as when you're coming into Hofstra having been a practicing nurse, and now you're coming to graduate school. And in the first year, you are basically one of 4 different types of graduate nursing students. There's multiple different degrees that you can get here too right now. You can get a master's or a doctorate, and you could be among one of these 4 tracks, but you're all together. We've decided to undifferentiate the differentiated graduate nurse early in their career because we think they all need to work with one another. That's one thing. They need to know how to communicate with one another, and they are all situated at different pathways and different waypoints within the trajectory of a patient who's either going from the community to the hospital for inpatient care or acute care, and then leaving the acute care or the hospital and going back out into the community. So these people need to interact with one another, and all of them have different responsibilities within the larger healthcare system for ensuring that the community health equity is optimized and is reinforced. So we have students here, and we blend them all together. And we did an analysis. Now, this is a graphic of what their first 2 semesters look like here at Hofstra. And they're basically taking 3 courses spread across 2 semesters. And we sort of did an intervention, and we wanted to have them self-reflect at that moment, denoted by the bar. borrowing some language from the Zucker School of Medicine, we've sort of modeled our first year, the first 2 semesters, as the first 50 weeks, because we do some work in the summer. They get a couple of weeks for vacation, just a little bit, and then we send them off into the clinical environment. But at week 3, it's a very special week. In fact, that week is today. And for the first time, the first year graduate nursing students all together went to the West Campus over at Northwell Health, and they participated in simulations where they had to treat patients as teams, interprofessional teams. Regardless of their role, they were put in front of a patient, a simulated patient, and they were asked to solve a clinical problem. And it was the first time they experienced the transition from baccalaureate nurse to graduate nurse practitioner or advanced practice nurse. And they had to think differently, for the first time maybe. And so they've also had to, at this point, they've experienced 2.5 weeks of curriculum, which is all built around small group, case-based learning, a pedagogy that's mirrored exactly like the curriculum used at the Zucker School of Medicine. So we've extrapolated that and transformed it slightly so it can accommodate the graduate nurse. But it's a curriculum that typically is not seen in the graduate nursing programs. Interestingly, it is a pedagogy that we've also incorporated in the undergraduate program, and we're excited to see how that shakes out. But let's see what the transition looks like. And so this is like a word cloud of the transition and how they describe it. It's challenging, yet they find that there's enjoyment and they find that there's happiness and confidence, but there's lots of nervousness, and it's definitely overwhelming, and stress and anxiety. I mean, there are definitely facilitators here towards keeping someone moving along the trajectory, and there's also barriers here that are inherent in this word cloud that are going to sort of detract and inhibit their willingness to sort of go forward. And it's only this is only data from 5 years, 3 weeks in, one-time sort of snapshot. And this is all comers. So the challenge is that I think this word cloud might look slightly different if this was only the underrepresented minority and economically disadvantaged student, or that student who's coming for the first, to university for the first time as the representative of the family, and then coming back to grad school for the first time. So there are some future goals and some future thoughts. So the work that we're doing is we want to do a needs assessment of that population, of that student, to better understand what is their specific transition and what are the supports they need. What are the supports they need before they ever get to graduate school, and what are the supports they need when they come to graduate school, because we want to ensure their academic success. So the future goals that we have for this program, and with the initial seed funding that we've received from Hofstra University, and we're grateful for that, we want to do the needs assessment, but then we think we're going to need larger and more sustainable funding, which we're seeking out now to build the pipeline for the graduate nursing program. It doesn't really exist in nursing. I haven't seen it in nursing. And people talk about transitions through different stages of educational trajectories, but we haven't seen the study of the transition and the experience of what the transition feels like in the underrepresented minority and economically disadvantaged student at 3 weeks. We haven't seen the early experience, and we don't want to wait till the end. So we want to know what is the early transition like, and how do we support that? Because we find that people attrition out early. The metaphor we use is like the Navy SEALs. They ring the bell early because they don't feel that they can do it. They don't believe that they can do it. They don't believe that they can belong in the field. And that's the misconception that permeates through the literature would say that that's a perception that permeates through the underrepresented minority and the economically disadvantaged and the first-time college student representative of their family. That's the belief that they have, which is totally untrue. So we want to promote returns to graduate school. We've got to sort of make the case that we need those leaders that are already practicing nurses, but we need them at the DNP and the master's level, because they are the ones who can actually affect change in a far greater way. They can lead and innovate and develop the programs that help to sustain equity, healthcare equity across communities that we live in and serve. We need to, once we make the case that they believe that they can return to graduate school and that they can actually achieve success there, can we support the underrepresented minority and economically disadvantaged students' transition? And there's multiple transitions that happen. We're just looking at one quick one, which is just coming back to school, but there's others. We do think that there is some linkage between the pedagogy and the curriculum, both the formal and the informal curriculum, even the hidden curriculum, and the role transition, and we can optimize that. We believe that the pedagogy that we've exported from the Zucker School of Medicine, this case-based, problem-based pedagogy called PEARLS, that is one of the chief sort of vehicles by which we can help to ease the transition, along with other things like health profession simulation and other small group facilitated coursework. We feel that those curricular supports help. They reinforce the idea of community of practice, and so forth. And then we have to think about this last one. It's very interesting. If we don't address the social determinants of education in the students will never graduate. If the students don't graduate, they will never be able to affect change on the social determinants of health in the communities they serve. It's also a double-edged, this rolls on, it cycles on itself. Students themselves experience social determinants of health. That may prevent them from coming back to school in the first place. So we have to fix their social determinants of health also. They're in the community that we need to treat those issues first to help the social determinants of education, to help the social determinants of health in the larger community. And so I just wanted to conclude with that's where we're looking forward. That's where the story goes next, following what Dr. Ricardi started. And that's the work that we're doing over at across the health sciences and the health professions programs here at Hofstra.
So next, we're just going to lift this, and I'm going to facilitate a conversation. One of the things that Dr. Ricardi and Dr. Cassara both talked about was this idea of social determinants of education. And you've seen from their presentations that they've presented the nursing or health profession story. And we've presented that story from prior to even beginning to think about college and a prestigious university like Hofstra, all the way through graduate school. But one of the things that we would be remiss is why we're looking at the social determinants of education and the social determinants of health. Well, we've been very lucky since our inception of the School of Nursing and PA Studies here at Hofstra to also partner with the School of Health Professions and Human Services. Our curriculum is built around population health, health policy, leadership, communication. Why those things? Because one of the things that we know is that most medical errors happen because teams do not speak or communicate the same language. That most issues around chronic illness happen by patients coming into the emergency department. But where should those conversations happen? In community places. We are lucky here to be at Hofstra, but around the 5 miles of Hofstra are the federally qualified health centers. And in those federally qualified health centers, 60% of the patients that they see are from diverse, underrepresented, under-economically impoverished populations. And so this problem is not just a community problem, but because we are here at Hofstra, it is our problem within the community. So I'm going to ask you guys both some very tough questions and around outcomes. Dr. Cassara, you talked about having this aggregate data for all of the students and graduate. You talked about how we've moved forward to do these things. Can you talk about the outcomes of what you're seeing in graduate students for the last 2 years? This was a tough and very trying time. What were the retention rates among graduate nurses going through COVID? Was it similar, different, or higher than times prior to COVID?
I think, at least my personal experience, and I hope my perception's not wrong, but I sort of perceive that at least here at Hofstra Northwell that we had excellent retention in the COVID moment. I would say that as a group, as a cohort, all of them showed remarkable resiliency. I think that there were very few that attritioned out of the program. More so, what we found is that in the COVID moment, because they are professionals already, they actually went back into their communities in the old role, which is something that we try to encourage our students not to go not to go backward in role, but to look forward to the new role that they're trying to adopt, and not to assume the other practices. Obviously, they're working in our program because they are part-time students, but we always ask them to think as themselves as full-time learners and to think forward, not backwards. But in the COVID moment, they responded to the call, and they almost universally supported the healthcare mission, the larger healthcare mission of the community in the old role, knowing that at the same time they were still ongoing with all of their obligations. There was one group, the most senior group was already well poised to complete their studies. They formally would have probably had to go another 2 months, but informally they had already superseded the requirements of New York State. And so they were graduated early, and they entered into the healthcare system willingly and enthusiastically as advanced practice nurses, and they were put on the front lines just like everyone else. I thought there was less attrition in my experience.
And I would echo that. And Dr. Ricardi, that brings us to you. Yes, thank you. You've been with us as full-time faculty for a year. But we're also being a little disingenuous because Dr. Ricardi was with us prior in a role as an adjunct. So these very students that you are now seeing in your mentorship, you actually had the opportunity to actually teach at the graduate level and follow them. So what stories have you gotten from the mentorship from former graduates coming back to mentor the undergrads and be mentored by yourself? What are the stories that you're hearing in terms of sustainability of wellness and resilience that Dr. Cassara talked about?
Oh, we've had many stories, and I'm trying to think of one that sticks out, but I've heard stories from both the mentee, who shared this sense of belonging that they felt once they connected with the mentor. And now to the mentor, who are the graduates that came back to us, stated they cannot believe that they're guiding someone and they feel like they were in their shoes and can offer that guidance. So that relationship is amazing because, as I mentioned, it's growth for both the mentor and the mentee. So that is what particularly sticks out, and I can think of Tiffany LeSister, one of our graduates, and I think you know her well. She mentioned how inspiring it was for her that she felt she had a purpose because her mentee is struggling with the same things she remembers struggling with. And she said, I can't give her the answers, but I can give her the guidance that I knew I needed. So it's a great relationship. So I'm now excited so I can speak a little bit more to the undergraduates that will now be mentoring the new undergraduates. That'll be an interesting bond because of the struggles our first-year undergraduates had, right? Like normal students, but now they can share it with those coming in. So I think it's a beautiful bond.
Thank you. So Dr. Cassara, you talked about being an architect of curriculum building. We're very lucky here at Hofstra to have many interlinkages among many professions, whether law, health professions, social work. So how do you see what the architecture of the build that you've built translating to sustainable STEM for undergrad and sustainable health professions for all health professions, not just nursing and medicine?
Well, what's amazing is that we really do take an outcomes-first approach to curricular design. I have to say, in my experience across all of the health professions programs here at Hofstra, so I've seen the physician assistant program, and I've seen the medical school program at the Zucker School of Medicine, and then I've seen now the many different types of programs that intersect together at the School of Nursing. And I have to say that outcomes-based approach, taking that look first and looking backwards to say, how do we design and engineer a curriculum so that way it delivers what we intended to deliver? That's, I think, essential to ensuring that hopefully we form and we help promote the ideals and the values, the culture, and then ultimately the knowledge set that makes impacts in the community. And so some of the things we do as a microcosm is that we promote community and we promote reflective practice. We promote the idea that you have to have a value set. So we don't just put the values in any of those schools up on a wall or a placard, but they're lived by the faculty and they're modeled by the faculty. And then they're actually, the students come to embrace them too. We look for students that seek a school that embraces those sorts of values. So even on the matriculation side, we're looking to see if there's a good fit. And I think by doing all those things, when the student graduates, the ultimate outcome, and because we don't just look at student outcomes and metrics maybe that a university would be interested in. I mean, obviously, we are interested in things like retention and graduation rates. But in the health professions, especially when we teach these students as learners in the health professions, and even when we teach the faculty how to teach learners in the health professions, we say, well, yes, learning is at the center of everything we do, but patient outcomes is truly at the center of everything we do in learning. So I'd have to say that our approach to design, that outcomes approach or a backwards design sort of look, and an emphasis on core values, reflective practice, small group pedagogies that encourage and actually require that people actually talk to one another and communicate. We find that knowledge base can be grown very easily. Problems with scientific foundational knowledge in general are the easiest to remedy. The errors that occur in healthcare don't always center, or don't even predominantly center around errors in knowledge. They usually revolve around errors in systems, teamwork, communication. And so we try to really promote that. So we've taken a close attention to how the curriculum sort of espouses and fosters and promotes all the skill sets and competencies necessary to build a practitioner for the 21st century that can really has the eye on the ball. And the eye on the ball and the touchdown here, if we're going to use that metaphor, is patient outcomes. And then learning outcomes have to mirror patient outcomes. And you won't get, and so likewise, like the same paradigm we use with the social determinants of health, if that's the mission, then we have to fix the social determinants of education and the social determinants of health. They're probably one and the same for the student, but we have to fix those to fix the social determinants of health in the community.
Thank you. Well, I think on behalf of, our provost being here, I'm going to ask this question more to you, Dr. Ricardi. You talked a lot about, students coming with the GPA of 4.0, but not necessarily having the advanced placement. I heard you mention biology and chemistry, and we've certainly partnered very well with the College of Liberal Arts and Sciences. And yet your colleague, Dr. Cassara, said it's not so much about the science, but if they don't get through that social determinant of education, there is no being a health professional. So can you talk about really the sustainability with the young undergraduate that is seeking a career in health professions, and they get the connection from your poverty simulation? How are you making those connections to chemistry, to CO2 plus H2O equals bicarb? How are you doing that? What are the challenges?
Okay, yes, let me speak, hold on. So during the school year, as I mentioned, our first inaugural undergraduate class struggled in the science and chemistry. We made the connection with the departments. We reached out to academic success here. They have tutoring, but because we are a new program, they didn't have anything specific to the School of Nursing. So yes, we made sure that the students, we created a blackboard for academic success. We put on there all the tutoring that was available. We begged, borrowed, and stealed from the physicians that work for the School of Nursing and said, please, can you tutor bio and chemistry? We also did small little groups and made certain that they knew, and this is something we've spoken about and learned when we went through graduate school and doctorate school, please form study groups. And then, of course, we brought in study skills. So if you don't have that knowledge base, you don't have the ability to do those study skills. And as I mentioned, moving forward, because the undergraduates are 32 lovely undergraduates, said you must do something for these undergraduates coming in. So as I mentioned, we did the ALEX program. The ALEX program is chemistry. We also gave them the resource books, but in addition, we can't just hand it to them. If I hand a student during the summertime a book, they're gonna turn around and say, what, are you kidding me? Same thing with the summer program. So what we did was we met with them before school ended. We did, of course, a Zoom, so Zoom to some degree is very easy. We met with them before their school ended, some of them was still in prom, and had a positive meeting with them to let them know that the undergraduate class said not in order to succeed, let me not say that a good foundation in science, in your sciences, would help you be would provide you with the tools to have a successful first semester and second semester. So we did the rah-rah. We also shared with them that we rolled out the ALEX program, that the program will be starting in another week or two, but that we're also giving them resources, books, and mentioning that no, you're not gonna get work in the book, but please use the book as resource as you do the ALEX program, wherever your weaknesses are. It was the SAT and the Regents books. I believe we did chemistry and bio, and reinforced to them, this is not punitive, this is positive. And we know that our 56 students that are joining us have a passion for nursing because we interviewed them. So they went through an interview process, so they knew the majority of us at this Zoom meeting. And it was that powwow positivity of, please, this is for you to have that successful program for your incoming year. So what I'm working on now is hopefully we can get a work-study program in the School of Nursing because we need tutors. Don't have the funding for it, so creatively we have to figure out how to bring tutors in for our students.
And so what I'm hearing you say is that the sustainable tools of an undergraduate curriculum does sustain the future. I want to be cognizant of our time and then ask if there are any questions from the audience for Dr. Cassara, Dr. Ricardi, or myself. Yes.
Come to the mic. I know you have to come to the mic.
I know you mentioned the social determinants of health. Do you believe the economic determinants of health have any impact on graduation rates? And what are some other methods Hofstra could use or anyone could use to improve or mitigate the effects of those?
I'm giving it to you.
I'm going to say yes.
I'll say yes with you.
The most immediate experience that I can think of is more aligned with the graduate nursing program, but I'm sure it translates across any program in any discipline across any school. So maybe the way that I could best say it is that we have had students who academically are performing just fine, no issues. Top of the class, but there are economic disadvantages that they have, whether it's family member suddenly becomes ill, and then for no fault of their own, they just cannot continue in the trajectory because they need to work more. They are the sole source of support for the family, or they're the major source of support. And so a graduate student especially has that burden sometimes that we don't see in other programs. Like when you're an undergraduate student, you may not have the same thing. There are many that do, but I would say that in the graduate population, they definitely have more of that. I see more of that. And so we have had students, and sometimes the phrasing is just that we see that academic performance is not ideal. And it's not a slight against the person. It's not a measure of their characteristic or their capabilities. It's truly not that, because they wouldn't have gotten into the program. I mean, they are totally able, and they're actually totally willing. The problem is that the time is just not right. So the phrasing is the time is just not right. And usually we encourage leaves. We have had people take the pause. Don't give up on the trajectory, but just take the pause because now is just not the right time, and come back into the trajectory when the time is right. And we've had plenty of people that would have otherwise left in a less hospitable environment to delay as opposed to, just be discouraged and to just leave, but to delay. And then when they come back in, they're at a better situation in life for themselves and for their family, and they continue the rest of the trajectory.
And I'll add, I'm sorry, I will add that with our grant, our Nursing Workforce Diversity Grant, and I did not mention it because I can speak an hour on the grant and all the things that we are doing, we have a stipend that we offer. So we're trying to diversify the nursing workforce. So we do have a stipend to support 20 students for scholarship, as well as a stipend for food and travel. And that certainly helps some of the undergraduate students, especially the diversity of the workforce that we're trying to create. And the other piece that I'll add to that is this pipeline that we've created is a 360 approach. So when we have, how do we diversify the faculty? Because yes, we're diversifying the workforce, but when we're bringing in students, the faculty should look like them and understand that too. So one of the goals of the grant that we have is it's a 360 approach. When the graduate students graduate, it is hopes that they come back to us and teach. And we also use some of the graduate students and students in the grant to go out into the community. So they want to give back because we're giving them support.
I was going to say that's an excellent part.
Yes.
I think the other issue about a financial, social determinant of health is the things that Hofstra does greatly. Most of the problem is that you don't have access to resources. Well, in our school, all textbooks are available and free. There are open hours for the faculty to discuss those issues. And as Dr. Cassara and Dr. Ricardi said, we offer a tremendous amount of scholarships. And one of the things that I'm very proud about our graduates is that when they graduated, they actually helped become architects of grants. Mm-hmm. So we actually have a grant for the sexual assault nurse examiner that's free to any nurse who wants to do that. And that grant was co-written by one of our graduates. Dr. Riordan.
Thanks very much. So lots of questions. Really appreciate the presentation. Deborah, I'll just acknowledge and thank you for your comments about the importance of diversifying the faculty. Well stated. Michael, I did want to ask you, I was very intrigued by your comments about measuring the ultimate success of the program based on patient outcomes. So immediately I start to think about how you might do that, and also how you might do that in ways, because you clearly understand the social determinants of health, and so how do you ensure that you're measuring the patient outcomes in ways that truly reflect the student outcomes in diverse populations?
Yes, it's very interesting, and obviously the quality of the measurement's very important. We want to show that translation, that it truly is the student that's impacting the community healthcare equity and actually improving the outcomes. I mean, one thing is that the literature is already showing it. So I might not have it here because our program's so new, but the first fact that I put up there is that when healthcare providers, we put it sort of globally, like when they're just aligned with the communities that they serve and live in, that the outcomes there are based on things like mortality, morbidity, readmissions to hospital, even length of stay. Those are tangible metrics that on an inpatient or in-hospital environment that you can measure. And there's also these other tangible metrics that a health system or a larger, public health system of care will measure in an out-of-hospital environment to say, we can see that the different types of providers, or the providers, regardless of their role or profession or subspecialty discipline, that when they look like and are aligned with culturally, value-wise, and just in overall sort of mindset with the communities that they serve and live in, that all of those metrics seem to go in the right direction. What are the ones that we want to measure? It's interesting because obviously the easiest measurement to do in an academic environment is to measure things that are related to the learner, and that's one step removed, and we know that that's not accurate. However, in the academic part of the student's trajectory before they actually get out there, one of the things that I do as a subspecialty expertise is simulation. And so we put students in the circumstances. The poverty simulation was one type of simulation, but we put them in other simulations where they have to not only address all the healthcare needs of a patient from the science and the knowledge and the care, but they need to have the competency to address these determinants of health. And they don't go out into the actual world as independent practitioners until they can demonstrate competency with that. Then the next step is when they're in those communities, what do their patients say, and what does the data tell us about like how they're doing? There are other systems that have done that. I think we're just a little bit early in our sort of maturation, just to know that, because we've only put out two or three? Three probably classes now. But that's going to be the litmus test there.
Yeah, I would concur. I think the one beautiful thing that we're proud about in Hofstra is that Hofstra has changed Northwell. So through the work and competency-based education that we've done through all of the health professions, there are actually evaluations that are done on the students related to their patients. And we actually do in Northwell track these things that we call social determinants of health. How many patients do you see that have food insecurity? And so we're already beginning to see that our graduates, not only nursing graduates, but medical students that stay within the system, are more likely to track those sort of things in their charting than professionals that were trained at other universities. And so we do have a Center for Population Health at Northwell that we partner in bringing that into our curriculum and then getting that sort of feedback.
And I'll just piggyback on that. We have the DMPs working on their research projects, and they must include social determinants of health within their project. So it gets them to begin to think, when they do go out there, well, they're out there already, to begin that this is just, should be something we freely speak about.
And the most proud thing that I'm proud of is that our patients are coming in, filling out applications to come to Hofstra. And they're saying, I was this one's patient, and I want to do. And so we're thrilled about that. I think it becomes that full circle.
Yeah.
I guess maybe also, and then one last comment just to tie on to that. The COVID moment was like probably the ultimate social determinant of health, like most recently, and totally, overwhelmed the system and required some innovation and adaptation. And when we look at how the participants, at least in the local healthcare systems in Northwell, is one of the, our direct affiliation here at Hofstra, to see how all the different professions stepped up, whether they were students or as the graduates, and then just came just right online and sort of directly participated, or if they were, I mean, for our students in the graduate nursing program, if they were part of Northwell as a graduate of the program impacting the communities that we serve, they would have been very junior at that point, maybe like within like 2 years of graduation or less. And yeah, they stepped right in. In fact, the creation of the new profession that I sort of referenced, the one with the nurse anesthetist combined with the acute care nurse practitioner is a byproduct of realizing that there's a gap in professions that needs to be filled. And so that, not that, I don't know that outcomes suffered because of that, but we knew that outcomes could have been optimized even better had we had a nurse practitioner or an advanced practice nurse that fit that specific niche role. And so we created it. And so the proof of the outcomes of patients, the literature, just to make it clear, the literature would probably support the statement that if you're looking at physicians or you're looking at nurse practitioners or you're looking at PAs, if they're trained and they're trained to competency, which is now the model that's used in health professions education to train in almost like in a time-independent way, but towards competency, the outcomes actually sort of sustain across all the professions. And if you then also take the approach that we can have a diverse set of practitioners that align with the communities they serve, that the outcomes go up. So we have to prove that linkage here because we're so young, but that's what the literature says elsewhere, so I'm sure it's going to hold up.
I do want to thank my colleagues because the other mark of sustainability in health professions is lifelong learning. So Dr. Ricardi alluded to our first class of 20 DNPs. Of that first class, 90% were former Hofstra graduates. So the work that you and the other faculty have done, making learning a part of our DNA, that we're not afraid to return for that doctorate, that there is not that gap between the graduate degree and the doctoral degree, I really want to thank you for, and thank you for your presentations.